Okie dokie, Smokey. Okay. Well, this is the cart entrance to our brand new MDRD, and so this is one of the most fabulous things we've had. We have an area for our carts and our cart washers. The process is our nurses bring our carts in from the operating room once they've been worked on with our patients and all of our instruments and supplies. And then our MDRD staff don all of their protective gear. And once they've donned their protective gear, they come in and they'll grab the carts. They bring the carts over into this area of our decontamination unit. And currently with our decontamination unit, they would take all of the instruments off of the pans and they would spread them out for their gross decontamination and cleaning. These things are pre-calculated to fill up to the right concentration of enzymatic to be able to wash and clean all of our equipment, and this is where gross decontamination happens. Once this process is complete, all of our instruments will sit on this rack waiting to go through our washers, and our carts that were used in the operating rooms to bring supplies to this area now go into our brand new cart washer. And this is, I'm so proud of this. This is the most amazing piece of equipment this hospital's had, in my opinion, aside from the CT scanner. This is able to wash carts. It's able to do all of our equipment that we use, all of our stainless steel, all of our bowls. In the past, everything that was done for this hospital, from emergency to our ortho clinic, was done out of one of those smaller washers. And now we have the capacity to do everything in a much larger washer. So we're able to increase the speed at which we get our sterile supplies back to our patients into the areas of this hospital that need them. There's enzymatic cleaners, there's descaler, and there's a bright and shine cleaner so that everything comes out lubricated, pre-cleaned, and ready for the sterilization unit. So yeah. It heats to 86 degrees. It's an amazing machine to watch and process. It does has a number of different functions and does multiple different pieces of equipment. So it's fantastic. We also, complete with our cart washer, have cart racks that wash our pans. This was all done manually by hand before, and we now have a proper cleaning rack that can do all of our equipment all at once. So the speed of getting our instruments back to our patients in our ORs has gone up significantly. Best part of this is our ability to turn equipment around and get it back to the patients that need them. Once our instruments are decontaminated and washed, they go through a washer and enter onto our clean side. Once they're on our clean side, they get packaged, put in pans for specific surgeries that are done at this hospital, and they're put through our sterilization and our sterilizer processor. We've built a separate bay. We realize that cataract surgery is very essential for this community, and so we've built a specialty area for doing specific cataract surgery that includes ultrasonic and washing stations. We have a brand new high-tech washer that is top of the line, and it now does a lot of equipment that we were unable to do in the past for this facility. Now we're able to use our washers and cleaners here on site from our Steris suppliers. So currently we have 2 washers, and this is just in case. Currently we use one at a time. The key is that if we ever had one go down, we now have a secondary one that we can use in case of emergency. So we've been able to build in with this build an extra safety for our patients in this hospital, so we don't have to send any of our instruments into town for further cleaning and repair. We have a pass-through window so that our clean department, if they need to bring stuff back into our decontam areas, either stuff that we believe needs to be reprocessed or stuff that needs to be brought into this area for storage, it gets passed through from our positive pressure side, where it's the most clean, into this side. So in this area, we don't want to push it out into our patients. We want to suck it into here. So in our dirty area, we have negative pressure to bring it in. The reverse of that is we don't want that same contaminant to go into our clean area. So our clean area blows air. It creates positive pressure. So anything that goes into that area, from a mite to whatever else you may see, walking around, it gets blown out of that area and gets taken into areas like this where they're dirty. So we can complete a distinctly clean and a distinctly dirty area.
Oh, okay, thank you.
Keeps our patients safe. If we blow air away from them, we blow contaminants and everything that's around that away from them. It builds this sort of flow of protection around them that they wouldn't have otherwise. This is an absolutely fantastic space. All of our workers have typically been sort of hip to hip, working on both our endo programs and our sterilization programs, and this is just the best program. I mean, currently the way it runs is the efficiency levels have gone way up. We've got more space, they can move around, they have equipment. We have these fabulous height adjustables for ergonomics. units so that our nurses at various heights and sizes can actually work ergonomically to be able to be more efficient and work in what they're doing for their decontamination area. It's just a fabulous addition that I've not seen elsewhere. All right, so let's go over to the clean side and we'll just walk through some of that. So with every MDRD, we have to create an ante-room or an area of protection for both our staff and for the risk for contamination elsewhere. We have 2 ante-rooms in the front, one for carts and one for our nurses. This is a secondary ante-room that we have to separate our decontaminated area with our clean area, as well as with our endoscopy area. So this is kind of an area where we can prevent any cross-contamination. Fantastic. So this is Todd. He's our lead hand in our MDRD, and he keeps the quality of the instruments leaving the sterilization side, the clean side, at a very, very high level. The process from Todd's perspective on this side is once things have come through the washers, these washers are specifically designed to prevent cross-contamination. So if this door opens, that door is closed. If that door is open, this door is closed, and you can't open both doors at the same time, as well as you can't pass instruments back through. So if you have something you don't like, you can't pass it back through. It actually prevents you from doing that to make sure there's no risk for cross-contamination. Once they're washed, all of the instruments come out. Todd sets them up on here where he starts to assemble his pans on the table. And each pan is, we have some standard pans that we use here because we do specific surgeries. But Todd also can put together specialty pans if are required. All the pieces, all the instruments, anything that actuates, it all has to go through a quality assessment from Todd before it can get back into the core or be sterilized. Todd has bioindicators and chemical indicators that we've actually achieved our sterilization goals through our sterilizer. So you'll notice that this little line here says to accept or reject. Once it's been properly processed, it'll be a dark line that says accept. And these are how we know that our sterilization criteria have been met. We take those pans, we put them on our sterilization racks, and they go into our sterilizers. We're very fortunate, we have 2 sterilizers. Once Todd's wrapped the pans and brought them out, they sit on the racks for drying to prevent any kind of water condensation inside. We also have a plasma sterilizer for our much finer equipment like our scopes. They don't tolerate a rough heat and lots of wash, so they end up going into our plasma sterilizer. Once Todd's reached the process where his sterilization is done, the machines let him know that. He opens it up, brings all of his sterilized pans and all of his wrap out, make sure that the indicators are changed and that all of the equipment is properly processed, and leaves it here to dry. Once it's all sterilized, it's been given time to dry. He takes it through with these carts into the operating room core. And this is the last step between our clean MDRD process and our sterilization process where it goes into the patient's OR room where they're gonna have surgery. This is the cleanest area of the whole hospital, and it has to be simply because the last step from this point is in an operating room being opened with a patient. So this is the key. Once it's in the core, that's a locked off area. We have positive pressure in this area. We have positive pressure in the core as part of the design, which allows all the positive pressure to whiff down the hallway to keep everything at the doors that you saw in the very front at a safe distance so that we're constantly maintaining positive pressure, keeping bacterial burden at a limit so that we don't expose our patients. So that's what we were able to do in the proximity. Other hospitals have MDRs on different floors, and our efficiency model has gone up significantly because our core is right there where we service our patients. So as our output comes through, we are rapidly able to engage our patients in the operating room in less than 20 feet. So we're very, very fortunate here. And I think a lot of surgeons appreciate the fact that we can be adaptable because of that. So I'm very proud of that. And as you can see, we're on the clean side of the cart washer now. So stuff comes out to dry. Cart washer doors work same as the washer doors. When one's open, one's closed, and vice versa. There's no cross-contamination or risk for decontamination risk. So it's a fabulous chance. And as you can see, just by the hodgepodge of different bowls and basins on here, all of these used to have to be done through that little washer. That was this big for each case. And if we had any challenges with it, it was a real pause. You had to really pause to try to put it together. And so any challenges that we had would delay our surgeries, and a process that you could do to get around that is by trying to purchase equipment to try to offset the fact that you can't process them fast enough. And as you know, equipment purchases are always expensive, but they're absolutely essential. And this, we've been able to optimize both. So as we move forward, our hope is to just advance the quality of the program that we have because we now can get access to our equipment so much faster.